DonJoy difference, 4 points of leverage, and force point combined technology. From everyday exercise to extreme situations, leading an active lifestyle means different things to different people. Unfortunately, the farther we push ourselves and the more adventurous our pursuits, the greater the chance of injury. For many people, that injury will involve the knees. Over 2.3 million arthroscopic knee procedures are performed annually in the U.S., many related to cartilage and ligaments, such as the ACL. As a market leader in non-operative orthopedic products for over 30 years, DonJoy has pioneered innovative ACL brace designs and technologies to help professional athletes and active individuals prevent and rehabilitate from knee injuries. After ACL reconstruction, clinicians often prescribe and patients frequently request a functional brace. There are 3 primary reasons. 1. The ligament graft requires time to heal. It is at its weakest point from 6 to 12 weeks following surgery. 2. A functional brace provides a proprioceptive and psychological reminder to the patient that they've undergone surgery and need to ease back into normal physical activity. It's also an excellent adjunct to physical therapy. 3. A brace also offers peace of mind to clinicians, assuring them that their patients are protected when they leave the office. When considering a functional knee brace, it's important to understand the options available. There are 2 primary brace designs, passive and dynamic. Passive braces are composed of rigid anterior thigh and calf cuffs with soft posterior straps. Passive designs don't actively address instabilities at all times, which means the knee can move or translate before the brace takes effect. More knee translation equals an increased chance of injury. DonJoy's dynamic brace design actively addresses instabilities at all times, protecting the patient whether they're running, jumping, standing, or sitting. DonJoy pioneered dynamic bracing with the 4 points of leverage system, a unique cuff and strapping configuration that provides a net differential posterior force to the tibia, preventing anterior movement. Here's how it works. First, the anterior thigh cuff anchors the femur at the top of the anterior thigh. Second, the posterior calf cuff anchors the tibia at the bottom of the posterior calf. Third, the posterior thigh strap across the back of the lower thigh pushes the femur forward. And fourth, the anterior calf strap provides the crucial opposing force that applies a constant active load to prevent anterior tibial translation. DonJoy's dynamic 4 points of leverage system preloads the tibia, providing constant protection, and is clinically proven to significantly reduce strain on the ACL. A well-designed brace hinge moves freely and never hinders performance, but there's a big difference between standard polycentric hinges and DonJoy's force point hinge design. First, the facts. Over 75% of all ACL injuries, both male and female, are non-contact in nature, and women are up to 10 times more likely to suffer a non-contact ACL injury than their male counterparts. Frequently, the injuries occur during run-stop-jump activities. Most functional braces incorporate a standard polycentric hinge. These types of hinges connect the thigh and calf frames through multi-centered pivot points, providing a stabilizing force to the brace while attempting to mimic the knee's natural movements. DonJoy has taken hinge design and ACL protection to another level with its patented force point technology. Force point is the only hinge design that's clinically proven to protect the ACL. It enhances DonJoy's 4 points of leverage system to provide the most powerful and clinically proven solution available to protect the ACL. To better understand how DonJoy braces help prevent injuries, it's important to understand where they happen. ACL injuries typically occur while the knee is in the at-risk position. The at-risk position is defined as flexion angles less than 60 degrees. As the knee gets closer to full extension, the risk of injuring the ACL increases exponentially. The force point design simultaneously dampens knee joint extension, improves the brace's mechanical performance, and increases flexion angles. This reduces knee shear forces and decreases the overall strain on the ACL. How? DonJoy's force point hinge utilizes a spring mechanism to apply a gradually increasing amount of resistance during knee extension. The resistance reduces the time spent near full extension in the at-risk position, while increasing the posterior load applied by the brace on the tibia to prevent anterior tibial translation. The resistance is adjustable, engaging in the last 25 degrees of extension before coming to an endpoint. 5 different resistance levels, 0, 1, 2, 4, and 6 pounds, are available to accommodate patient activity levels and comfort. DonJoy braces aren't just for rehabilitation. Many high school, college, and professional athletes, as well as weekend warriors, wear DonJoy braces as a preventative measure to guard against potential injury. A recent clinical study shows that athletes who trained wearing a DonJoy 4 points of leverage brace equipped with a force point hinge were estimated to decrease their chance of a non-contact ACL injury by over 50%. That's confidence every athlete can count on. As long as people continue to push their levels of performance, DonJoy will be there every step of the way. DonJoy's unique combination of 4 points of leverage and force point technologies provides the most widely accepted and clinically proven solution for protecting a healing ACL graft, providing stability to an unstable ACL deficient knee, and providing prophylactic protection. Ask about DonJoy's Knee Guarantee, the world's first and only ACL protection plan. It's the powerful combination of performance and peace of mind that separates DonJoy from others and continues to make DonJoy the #1 brace company worldwide. Prescribe confidence. Prescribe DonJoy. The DonJoy difference.